So if you're going to give your patient a blood transfusion, the first thing that you want to do is check your orders and make sure that they actually have an order for the blood transfusion. Second thing you want to do is go to their chart and make sure or get consent for the blood transfusion. If it's after their delivery, it needs to be a separate consent, not the delivery consent. The third thing you're going to do after you get consent is go to the Epic chart, go under the flow sheets, and you're going to go to the blood administration tab. And if you search in this top box for blood, you'll see the blood administration tab, which is what you want to open. In the top thing, it says nurse blood contact info. So you want to put in your phone number for the day and the tube station you would want the blood sent to. That's the first thing that you're going to do. Once you've done that, so that they know the correct place to send it, in the top left, the box over here says blood administration. That's your release button for your blood. And then the second button there is when you're actually beginning your transfusion to be able to scan your blood. So you're going to fill out your phone number, the tube station, and release your blood. While you're waiting for that, you're going to get your equipment together. So that would include the blood infusion set, which is the Y set, and normal saline, as well as a pump with at least one channel. Once you have all that stuff kind of set and ready to go, you just wait for your blood. Once you get it, you're gonna take your buddy into the room to do your 2-nurse verification. You will spike your 0.9, spike your blood, and then start your pump. So when you're...
How do you prime the tubing?
So I spike the 0.9 and leave this side locked. Flow it through so that all of the whole entire thing is primed with the 0.9. Then I lock the channel here and the 0.9 and at the bottom down here, and then backflow into the blood so that you have 0.9 filling this prior to spiking the blood. When you go in to program the blood, you're going to do, if it's a new patient, and you're going to do adult. And then we're going to do it on channel A. Blood is under IV fluids. So if you pick on Guardrail IV fluids, and then you pick B, blood products comes up. So you'll pick the blood product, and then it'll allow you to do your rate. On your actual blood, there is a sticker. It's usually a colored sticker. It's not always blue, but it has your volume in it. And so that's what you're going to infuse. Generally, here we infuse blood over 2 hours, unless you're told to infuse it slower or faster. Blood has to be administered within 4 hours once it arrives on the unit. Otherwise, it will not be good. So, when you're doing your verification, you do just as you did before. You read the blood against the patient's bracelet and the blood administration form that comes with the blood. So you read name, date of birth, MR, your pool number, your donor type, and your recipient type. Your expiration date is here, and that's what you're going to read. So you're going to verify that against the sheet and the patient's bracelet in the room. Once you read that, you're going to go back to your Epic, and there's the button for the begin blood. And when you do begin blood, it will prompt you to scan your blood for the pool number, for the product code, and then it will make you enter the expiration. So when you hit this button here, it won't show it because it doesn't have an active order, but that would pull up what looks like the label from the blood to have you verify everything. And then once you scan everything and it's been verified, then you will hit the begin blood. And when you do that, it will ask for the second nurse verifier's information. So it'll give you the Epic logon to enter your name and password, and that's your second nurse verifier.
And that's in the computer here.
Correct.
All right.
And that's it.
Thank you.